Welcome, everyone. And we are going to start by apologizing for the delay we had. It was a lot of issues at different locations, but we are here now and we're not going to waste any more time. Welcome, 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 everyone. We are talking about depression. And I have with me today two wonderful women. They are brave and bold enough to come out here and share their personal stories about depression with us, not for any other reason, but to help other people out there. I talk about the theory, I talk about what's in the book, I talk about numbers, but these are people coming out to share their story with us. And with me today, I have Mrs. Bola Zion. I call her Bola Zion, but she's Bola Oyediro. She will tell you more about herself, and she would focus on postpartum depression. She experienced that. And I also have with me today Mrs. Temidayo Falade. She had what we call major depressive disorder. It was very tricky. And I'm sure it's like that for so many people, and they are here to just take us through what they went through. So I and the other guests will go backstage while they take the spotlight and share their story. So everyone, please welcome, welcome, invite people to join. This is going to be life-changing. I promise. So, Miss Bola, I want you to say hi to everyone.
Hello, everyone. Good evening. It's a pleasure to be here.
Yeah, you're joining us
I
from
hope we're gonna have. Pardon?
you're joining us from where? Let them know.
Oh, where am I tuning from? So I'm tuning from the United Kingdom,
Okay.
and yes, I'm happy to be here.
Okay. Mrs. Temidaya
Thank you for having
Faladay,
us.
Ms. Temidaya Faladay, where are you joining us from? Say hi to our viewers.
Hello, I'm joining from Akure, Nigeria.
Okay, awesome. We're not wasting any more time. I'm going to let Ms. Bola Zion take the stage and we'll be right back. Okay?
Yeah.
Hello, everyone. Good afternoon, good evening, good morning, wherever you're tuning in from. My name is Mrs. Bola Oyediro, and I'm a mom to two beautiful children, a wife to a wonderful king. And so I should introduce myself a little bit. I am a money coach, so I help people with their money management. And that's it, really. And I'm really happy to be here. Because we don't have much time, I'll just go straight into my story. However, with all due honor and respect, I would like to say a big thank you to Dio Adeyemo for the privilege and the honor to come here and share my own story. And hopefully, it would inspire someone and change someone else's life. Thank you so much. So, postpartum depression. How did it all started? So, I'm going to start by I'm going to start with my pregnancy story. And the reason I'm going to start my pregnancy story is because my pregnancy was actually what triggered postpartum depression, even though I wasn't aware that how I was actually going through postpartum depression. I can call it postpartum depression during pregnancy, but should I say the depression started during my pregnancy? So what happened whilst I was pregnant, I had a major life event, and that was me having to leave my job. Now, before having to leave my job, I just finished, my master's and got this very good job. It was every young person's dream. And I've literally built my world around it. And I became pregnant, and my pregnancy was a very sickly one. Due to the sickness of my pregnancy, I was missing work day in, day out. And at some point, my employer could not stand it because I was a contractor as a then, and they were paying me a daily rate. So you understand the gist. So what happened? I had to eventually leave that job and give in my resignation letter. After that event, everything went down. When I mean went down emotionally, I was down. I felt like a failure and inadequate at that. I did not like the situation around me. And to be honest, after being sick for many months, and let's say by my third trimester, I thought to myself, maybe I should get another job. But really, really and truly, no one really wanted me on the job. No employer wanted to employ me. They didn't say it to me because that would have been a discrimination. But I knew that no one wanted, to get me on board being 7 months, 6 to 7 months pregnant. And that went on. And the pregnancy, like I said, the pregnancy was really sickly. Nothing stayed inside. I was unhappy, even though I had a very supportive husband during my pregnancy. And I said on my chest, very supportive husband, but yet it did not change the fact that I was really unhappy. Now, the baby came. And on the day the baby came, now don't forget I've been depressed whilst I was being pregnant. So now my baby came on board, and as a new mom, being a first-time mom, I ought to be very excited. But that wasn't my own story. I was not excited when my baby came. Now these are all signs, that you should be picking up from. But at this point, I didn't even know what was going on with me. But yes, when my baby came, I was very unhappy. I wasn't excited. Should I use the word not unhappy? I wasn't unhappy, but I couldn't. So this, can I still explain how I felt, my emotions? No. But one thing I knew was I was not excited. My husband was elated. He was very happy that we have a baby. I remember vividly when the baby came out and eventually came out, after pushing her out. They wanted to bring it to me as normal. Oh, yes, your baby, congratulations, Mr. Yedira. And in my head, I remember the first thing I said was, I am just so tired. And I rolled my eyes. But at that point, the midwife, that did the delivery for me, held my baby, and my husband was standing next to her. And they were literally staring at the baby. Oh, she's so cute. She's so cute. And I remember saying, oh, I just want a book right now. I'm so tired. I was not even looking at the baby. The last thing on my mind was the baby. Long story cut short, after staring at the baby, that's by my husband and the midwife, they gave me the baby to just, have the first touch, as they call it, the bond. So I held it to my chest, but I didn't feel anything. I just kept saying, you know what, I'm just tired. Perhaps before I had that, I remembered having a long-term contraction. I mean, I was contracting for 5 days with little or no progression until the 5th day. So by the time I pushed her out, my body was tired. I was tired. And yes, we left the hospital. After leaving the hospital, my mom came. I remember my mom would come early in the morning. She would give me a bath the baby, help out with baby dressing, then go to work, then come back at night to just give me a shower as well, and then shower the baby. So she did this for 3 weeks. So I had good support. But little did I know that I wasn't just interested. It didn't click on me. Right as of then, to me, it was more like, oh, I have support system helping with the baby. My husband too was helping with the baby. So I just felt like I just needed to rest. I've done all the hard work. But something in me wasn't just wanting to hold my child. Something in me just doesn't want me to even want to, bond with her. I remember as early as 5 days into my delivery, being at home, I was already going out. I just wanted to leave the house. I wasn't just happy within me, but no one knew this. And I couldn't just understand why. Now, after 3 weeks, my mom stopped coming in. Now I can back the baby myself. And after that 3 weeks, my husband was actually fully back to work. Now it's me and the baby at home. At this point, it was so bad that I would look at my own child, and I never felt any emotions that were there. I would look at her. I actually wrote down this. I would look at her, and I didn't see any beauty in her. I did not see any beauty in my daughter. I remember there was a particular time I looked at her, I was like, this girl looks like a monkey. Imagine I actually called my own daughter. I actually said she looked like a monkey. And I remember as well, once it's 4 o'clock, maybe past, my husband texted me, I should be leaving work at this time. And I remember as well, we were living close to a train station. I will literally be looking out the window and checking the time, looking at the train times, thinking, is this train coming now? Just for him to come and take over the child. I did not want to have anything to do with my child. I didn't want to hold her. And this went on and on and on. When people see me, they believe, oh, she's so blessed. Oh, our daughter is such a daddy's girl. Our husband is so hands-on and so helpful. I am so grateful for that. But beyond just having a husband that was so helpful and a child being a daddy's girl, I was so detached away from my daughter. I did not want to bond with her. Another thing that happened as well was that I remembered my sex drive was out of the blue. It was out of the window. I didn't want any intimacy. Touching me was making me feel somehow. And I remember saying maybe it could be my contraception that, maybe due to hormone change and all that, maybe that is why I wasn't interested. Everything just wasn't of an interest for me. Now, I remember my appetite was down. I wouldn't eat. When I want to eat, I eat too much. And days when I wouldn't even eat at all. I hated my body. I was so depressed. I look at myself. I look at them like, oh, this is what she did to me. I did not like myself at all. However, this went on and on for 2 years. Can I put it to you that it was so bad that for the first 2 years of my daughter's life, I didn't really have that bond of, when they say you give a child a shower after night, my husband was the one doing it. So my daughter we have a routine whereby she has to take a shower twice a day. And those 2 times, my husband was one that was back in this day. And I didn't even see anything wrong with that. He would really want to bath her, read bedtime stories, and then rock her to bed. And I would not even get involved in it. I was just so detached. I was not just interested. Now, how did I find out what was wrong with me? How did I find out it was a postpartum depression? There was a day we had a conference, ladies conference, and I went there. And they picked a topic, pregnancy and motherhood. And one of the speakers spoke about postpartum depression. And she started speaking about the signals, the symbols, the feelings, your emotions, your reactions, and all sorts of things. It was then it dawned on me that I was going through postpartum depression. It was like my eyes bleated, like something just fell off my eyes. Like I've been in darkness. I didn't know what was going on. That was when I became aware of what was wrong with me. And that was my journey. That was the start of my journey into healing. When after leaving that conference, I remember going home and so many things were ringing in my head. I was just flashing my phone. So this was how I was acting like this when I first had my baby. So this was why I was acting like this. I didn't want to touch her. I remember getting. I was like, babe. I was saying this in my language. I remember, babe, postpartum depression. And I was like, really? What is that? So he didn't understand what was it. So we had to go and Google that everything. And I started reading up on how to overcome it. And I realized that when I was going through that postpartum depression, I lost my drive and my drive and willingness to do what I would normally, enjoy. The things I enjoyed doing, I stopped doing them. I wouldn't want to go out. So after finding out, I became, intentional about, just overcoming and battling this thing and getting it out of the way. I remember the first thing I did was, I remember contacting a dietitian and saying, I want to change my diet. I didn't like, look, I want to lose weight. So I began a journey into weight loss. And after dropping the weight bit by bit, I started feeling happy. I started getting comfortable going out again. Then another thing, I found that my sex drive started coming back to normal. And thank goodness, around that time when I found out, my husband had to, go to another city to work. That means that he's away for some couple of days and he's just with my daughter at home. So I had to, how should I put it, not force myself, but I had to just come to terms that this is my child and intentionally love, nurture, and step up into my role as a mom. So I had to start bathing my child. I had to start rocking and reading the entire stories. It wasn't easy at first, but I wasn't used to it. I mean, it was so bad that when it comes to even handling my daughter's pram, I didn't know how to handle the pram. I would literally call my husband and say, babe, how do you unfold? Do you fold it? That was how bad it was. But after finding out and doing a lot of research and being intentional, gradually, process by process, I just take try to take the day as it comes. And we're here today, and I can say that I battled it and I overcame postpartum depression. But I am so grateful for the day I found out that I had postpartum depression after 2 years. Now, after finding out, the guilt started. I started feeling guilty. I felt like I hold my daughter the 2 years of not bonding, of detaching away from her. And she had major life events that positive, and I felt like I wasn't there fully. I wasn't there fully. But I am so grateful because life happens and there's some things you don't have control over. And I can say postpartum depression is something that you don't necessarily bring upon yourself. It happens for different reasons. So if you're like me, please stop feeling guilty and just start making most of the time and the seasons that we have with your children. I think I will stop there really, and yeah, we are. I guess I remember now. Now I have another second child because of my experience with my first one. And I had, at that time, whilst I was pregnant as well, my second, I had kind of like a life major event. But I became intentional because I'm aware of the signs. And I remember affirming, I would make affirmations such as, oh, motherhood is a beautiful thing. Pregnancy is a blessing. I will enjoy this motherhood journey. My daughters will enjoy me. It's a blessing. Every time I feel that, I will get up. I'll literally get up and just affirm. Look at my daughter's pictures. I will smile at them, smile at the pictures, smile at myself. In fact, even after having the baby and you know how the body changes, I look at myself like, well, you look so good. You're so beautiful. In fact, the things that I couldn't do before, I chase them now and I do them with my whole heart and with energy and with joy. So if I can overcome postpartum depression, anyone can. With support, with awareness and intentionality, you can overcome it. I will stop here. I can't hear you.
Okay, can you hear me now? Okay, I said thank you so much for sharing that journey with us. Talking about the negative self-perception, which was one of the things you told me. You didn't like how you looked. You lost interest in things you used to enjoy, poor appetite. You had disturbed sleep pattern. You lost interest in the things that you loved. You couldn't bond with your child. Lots of rumination and negative thoughts. And even with the most supportive husband and your mom being around, you could not, you just couldn't. It was a blessing to you, but you could not get over this thing yourself. And it took you 2 years to know.
Yeah.
So just briefly, if you can do it all over again, would you have sought help if you knew about this? Because now you've invited me to your show. We've talked about it.
I would absolutely, Dio. I would have asked for medical help because I remembered even right during my pregnancy, I would go for antenatal classes, and they mentioned postpartum depression, signs about it. But I never thought it would even happen to me. It didn't make sense. I couldn't just connect why a woman would go through that. Maybe I was being judgmental and accelerating my own strength. It could be. And I remember even having my daughter, the nurses, community nurses would come and visit you. And within 24 hours of getting back home from the hospital, they'll come and visit you and ask you, is everything okay? Do you need any help? Are you feeling down? Even after 2 weeks, they do another checkup to ensure that everything is fine. Are you feeling sleepy? Are you deprived? But I could not just connect it that was what was wrong with me. So I can imagine if I had opened it, if I was aware and I spoke about it, they would put me through a process. And just to mention this, people get scared of, I don't want to be put on medication for depression. No, I've come to realize my own little way of coming out of it. It doesn't have to be medication. Little things are just stepping out, taking a walk, opening your window, seeing the sunset, the sunrise, dancing to your favorite music, eating your favorite food, just reflecting on the things that makes you you. These kind of things just takes you out of these things. So I don't know what person they would have taken me through, but depending on how severe it is, you might not have to be on medication. And mine was kind of went on for a while. Yeah. So I can imagine if I started early, maybe when I even got it, it would have gotten so deep before even coming out of it. So the earlier, the better. But whichever stage you're in, seek help, seek support, speak out. It is real. And you know what I'm scared? I was scared of that when I found out. I was saying to myself, if I hadn't found out at when she was 2, maybe I would have thrown her out of the window. Maybe I
Oh,
would have thrown her away. Maybe some I could hurt her or harm her because I just felt she came to disrupt a lot of things. I didn't even know what I was doing. My mind was somewhere else.
yeah.
So I'm so grateful that I found out when I did. So seek help, please do.
Thank you for sharing that. And after we listen to our second guest, I'm going to give us like a brief summary of what postpartum depression is about, what to look out for, the difference between postpartum depression and baby blues, and the treatments. We're going to talk about treatments of depression next week, but I would also give us a tool that we can use with our what's it called, OBGYN, or that we can even use at home. If you use the tool and you get your results, you can take it to your physician to share the results with them. So I will share all those things, but I'm not going to say nothing until we hear from our second guest. I really need you to listen in. So, Mrs. Oyedinro, thank you so much. Don't go anywhere. You and I will go backstage while we give the floor to Mrs. Faladay. Okay?
That's fine. Thank you so much.
You're welcome. Thank you. It's your floor.
Yeah, good evening from here, and maybe good afternoon or good morning wherever you are. So, my name is Temidayo Olajumoke Falade. I'm a chartered accountant by profession, and I'm a public servant. I work with the state government where I am. Yes, my case started in 2011. When it started, I knew I was having pains all over my body, the feeling, of being down. I didn't really know what was wrong. I went to the hospital. I thought I was having things like malaria or typhoid or something. I was tested, treated because initially signs of malaria was seen, and they treated me for malaria, typhoid. But after the treatment, I was not getting better. So I started seeking further help, but yet I couldn't get help in that direction because as at that time I had no idea what depression is, and so I never could have thought of it that I had depression. So it went on, and I started losing interest in those things I used to, derive pleasure in. I was no longer functioning well at work. I will only manage to pull myself out of bed. That was how I was managing, struggling with life until 2012. By 2012, I moved to another stage again. I lost sleep. I remember vividly there was a time, by my counts, I was not sleeping for like 21 days. And during this period, I was doing this praying stuff, studying the Bible because I'm a Christian and I so much believe, in the Bible, in prayers. And so that was what I was doing for that period. And then I started seeing things that ordinarily does not exist. I can see a parked car and I'll discover that I see people inside, even when there is no one. Things like that. I see pieces of paper on the floor, and to interest me to want to read those things that are there. So it was like that until one day in June 2012, I met a pastor of mine, somebody that has pastored me in the past. And when that woman saw me, she quickly knew that something was wrong. One, because she's a medical practitioner, she's a nurse, but not a psychiatric nurse anymore. And her husband too is a medical doctor. As a matter of fact, they have an hospital. So she saw me and she discovered that something was wrong. So she linked me with a psychiatric doctor. So at that time in 2012, I met a psychiatric doctor who diagnosed me and started treatment. So I was placed on the medications. I took injections and I was on like that. So in the course of the treatment, I was told that this treatment is not a one-off thing. That it's not like malaria that you treat and maybe for like 3 days and you're good. So I became afraid. That's what will become of me after this time, you know. And then it got to a point. I summoned the courage and I asked the doctor. I said, Doctor, can I meet somebody who is a survivor? Who can tell me that I will be fine again? Who can give me the courage that I need? Because at that time, I had this, sense of hopelessness. In fact, before I got to that stage, there was a time I felt since I'm not coping at work, since I'm not taking charge of my responsibilities at home, I don't know how my kids feed, I don't know how they fare and all of that. I felt, let me take my life. I remember I did a recording and I already said the things like the passing words to my children and I kept it somewhere. But somehow I didn't succeed. That was then. So I wanted to hear from somebody who is a survivor that I can be fine again. But when I asked the doctor, he told me that for him it's so unprofessional to link me with somebody that has been through it before. And that's another thing is that people are not willing to talk about it because of fear or stigma. So that's one. I kept it inside of me that if I could pull through this, I will want to fill that gap. That this is a gap. Now, why won't people talk about it? We should talk about it and make people know that it's something that can be treated. And so later, the man told me I will need talk therapy. So he referred me to a psychotherapist. And then I started seeing that woman. And luckily for me, she took me as a friend when she met me. She encouraged me because she works in a psychiatric hospital. And she said from experience, she knows people don't will they don't willingly come to the hospital for treatment. And that for somebody like me, maybe with my status and all of that, it might be difficult coming. So she said, if I will be coming to see her, so I should just come as a friend. And so she brought me so close to herself. That encouraged me a lot. And I want to give it to that woman. She really tried for me. And at a time, another thing now happened. Because after some time, while saying I got better and I was going back to work, doing the things I used to do. And then inside of me, I felt, but you are a Christian, you can pray about this thing. Is it necessary to take drugs? And so somehow I skipped my medication. I'm saying this again because I want to encourage those who are on medication. It is not in place for you to skip your medications. If you are going to do anything about your medication, please try and see that professional. Discuss with your doctor. It's very, very important. I took that decision on my own. And so I skipped my medication. And after some time, there was a serious relapse. And so, but there's something I missed. Before skipping my medication, before I got better, during the talk therapy, the psychotherapist, invited my siblings. If I had one of them who is a pharmacist, she brought him in. She discussed with him the support I needed and all of that. She also brought my husband in because for my husband, he doesn't even know anything about depression like myself. So she had to tell him what it is. And she also took time, to go through sessions with me. We're talking about, various issues in my life, that could have maybe be the cause of the depression and things like that. So we're having series of talk sessions. So at the time I skipped my medication, like I said, the relapse came and it was a terrible one. It became worse than where I started from. And so by the time I went back to her, she said, "You're not taking your drugs." And of course, I confessed to her that I was not taking my drugs. And she said, "What is happening now is the effect of the drugs you not be taking." So she said I should go back to my psychiatric doctor. I told him And then we started again. And then it took a longer time for me to bounce back, after resuming medications again. So I became better again and continued with life. And so after some time, when I became stable, I felt this is my story. I will not keep it to myself. I have to look for opportunities to talk to people about it. That's There's something called depression, that's one. And that two, whenever you notice anything about your mental health, that you should try as much as possible to seek help. Because we are not, most of us, especially in my own part of the world, in my country where I reside and where I am from, Nigeria, we are not, aware enough of mental health. And so I felt I wanted to do something to create awareness, to sensitize people and all of that. And that's what led me to what I'm doing now. That even made me to, identify somebody like Mrs. Oluwadayo Adeyemo. She's doing a whole lot, and I really appreciate her. I thank you for the opportunity you have given to me tonight to talk to people about my experience. And I want to say that anytime the opportunity avails itself, I want to still talk to people about that. I can't afford seeing my enemy pass through what I went through. I can't afford it. It was terrible. I got to a point in life where I would see my kids unkept and I can't attend to them. And it can be painful as a mother. So at that point, I felt, why are you still living? Let me go.
Hmm.
But thank God I didn't.
Thank God you did it.
That's my story. Yeah.
I can't thank you enough for sharing this story. I cannot. It's with mental health stigma, the low awareness that we have, it's difficult to come out and talk about having any mental illness. And you coming out now, I'm sure it's going to help a lot of people. I want to highlight some stuff that you mentioned. The first is that you didn't even know what was happening to you. You didn't have a clue. However, someone who is a spiritual leader
Yeah.
saw you and encouraged you to go for psychiatric evaluation. Now, that is not enough. It is not enough to be told. I want to give you credit for listening to that person and taking that step. You didn't say you go see a
Now,
psychiatrist.
now let me say something.
Yes,
It
say
was easy for me to take that step because I so much believe in her.
in her. So that means when a spiritual leader is able to be in that position to encourage people
Yes,
to go seek treatment,
and
it
exactly.
okay, what if she did not say that, or what if someone else who is not in your spiritual circle
Second,
had told you to go and seek psychiatric evaluation, and this same person said, "No way, you don't have to go." Because remember, there was a pastor that encouraged you to go seek help. There was
to skip
another
my
pastor,
medication.
yeah,
Mm.
and there was another pastor
That we should practice faith.
so, and you listen to both of them. You listen to both
Yeah.
of them. You see? So I want to use this opportunity again to highlight the importance of religious leaders knowing about mental health, encouraging people to seek help because they are authorities in people's lives. And what they think, their perception, their opinion really go a long way in what people do and would not do. So knowing about mental health in our, spiritual world or religious circle is very important. So we thank your pastor, both of them that supported you with prayers, and those the person that did that. Another thing I want to point out is that you started taking medication, and at some point there was that need to add talk therapy, psychotherapy to it. So you did combined treatment. That's what we call combined treatment. And
Yeah, I
I
did.
want to tell people that, sometimes some people will start with therapy, and at some point your psychotherapist might encourage you to go see a psychiatrist or a psychiatric nurse practitioner to start medication. And then sometimes we need both, just like in your case. So that is actually the most effective treatment plan. Combination of pharmacotherapy and psychotherapy. So thank you for being bold enough again to accept the treatment plan. Another one I want to say is the support you got from your family. I'm going to bring Ms. Bola in so it can be more interactive for us. The support you got from your family. You got, the therapist had to bring in your siblings. At some point, your husband had to join. And they imagine if your husband opposed to your treatment. Do you think it would have been easy?
In the first place, how do I take my drugs in the house if he says no?
Some people actually hide it, because I have some patients who they know that they need the help. They come and seek treatment. They don't want, that time they will tell you, no, I need to come when I'm at work so that I won't have to tell my husband that I'm coming here to see. So they're seeking help. They take their medication. They have very creative ways of
Codedly.
yes, so that their husband would not know, or so that their in-laws would know, or so that their co-workers would know. It makes treatment difficult. So it's a good thing that you both had very supportive spouses. So
Can I say something, Dio?
yes.
After my experience, I remember there was a day, and I'm not shy to say it, I used to be a very judgmental person until life happens. You go through experience, you're like, ooh, it humbles you, like, Lord, forgive me. And I remember sitting down, I was like, babe, at this point, if I find out that someone is pregnant and whoever is responsible for that pregnancy is not stepping up to it, I can sue that person if I have that power. I said, I don't even care if the person happened to be a so-called prostitute, if there happens to be a one-night stand. I said, because I don't know how I could have survived without your support. So I don't care how you got the person pregnant. Please be there. I'm not saying get married to the person. No, I'm not a relationship coach. My own is money coach. But I'm just saying, be there for whoever you impregnate. Whoever, be there. It doesn't matter the circumstances. Because I'm like, how would I have survived it? It didn't make sense. I couldn't just picture me scaling through without that support. So I don't care if that person. So for me, that used to be a judgmental person. If I see a single mom, I'm like, If I say, But when I went through that, there was a default of just being gracious and just being grateful that it happened. I started to see that could have been me. I could have been that prostitute that didn't have someone to support me, and I could have still go through what I went through. Maybe that would have taken my life or even throw that baby away. Thank God the dad even wants to see the baby. Imagine the dad doesn't even want to see the baby. What would have happened? I would have just felt like a total failure because I was already feeling inadequate anyway. So for me to have said that, I knew that, okay, like something happened to me. And this is just to, just advocate that whoever it is, being a mother-in-law, a sister-in-law, a husband, whoever you are, if someone just had a baby, even from the pregnancy, a friend, even at a baby shower, if you have a friend that used to be very bubbly and all of a sudden they're quiet, or if you have a friend that happens to be very happy, overly happy. I told you that during my time, I became overly happy. Normally, my personality is a bubbly, outgoing person, but it now became more. I was trying to hide what was wrong with me so that you never think I'm going through anything. So when there's a change in someone's personality or display to out, they're just out of character, please just check with that person. You don't have to say, are you mad? Just, you sure everything is okay? Do you want to talk? You will be amazed what people are going through.
You're right. So yeah, the having a supportive spouse is very significant. However, I always like to say, the other side of it. There are people that, for some reason, loss of a husband, a war, people with war zone, people with, things happen. So that is why even any one of us that we have the privilege of being in a pregnant woman's life, or any one of us in this instance, I want to highlight the religious, circle or organization or a place of worship for any one of us, regardless of the religion or that we identify with. Anybody that is close to us when they're pregnant, we should help them, and even as a friend, a church member, we should help. And at this point, I want to say that even though we're all women here today, does not mean that it's only women who have depression. So men also go through depression, and when it's happening to men, we need women to also step up and not just call them lazy, call them irresponsible, put them down more. We should think, could something be wrong? With men, like I said last week, it's not the typical depression that we see in women, like they're sulking or crying or just, curling up. In men, it shows as irritability more. It's anger more. It's turning more into their work, and not, just wanting to hide it. I mentioned smiling depression last week, which is what you alluded to when people try so hard to cover up what was going on with them. On the other hand, we have a situation like Mrs. Faladay's situation where, she was really down. She could not, I experienced something similar to hers. She could not take care of her children. She could not take care of her home. She was not grooming her body well. Everything was just down. So yes, all those things are significant. So I'm glad that you did that. And one thing, again, that I want to highlight for Ms. Faladay is that you needed somebody to talk to. When your doctor told you this is not a treatment like malaria that we're just going to do for 5 days and it will be over. This is a long-term treatment. You wanted to talk to somebody, you didn't have that available. So when you overcame yours, you decided to start a foundation, Help for the Depressed Foundation. So I want people out there to know that something really good can come out of our challenging experiences.
Absolutely.
Mrs. Oyedira, you also have a women's ministry. I was on your show just 2 weeks ago or last week.
Yeah, 2 weeks ago, yeah.
And you wanted me to talk about depression and helping women to do that. So you guys you're impacting life. From that story that seemed really bitter, very challenging phase of your life, look at what you're doing and see how you're helping people. And I want to use this to encourage more people to please speak up. I need more men to contact me so you can come here and share your story. And we have men identifying with you and saying, hey, if this person can talk about it, I don't think there's a big deal. So you are helping us normalize mental health discussion. Thank you so much. So is there any last thing you would like to tell people? And then I want to quickly show us something, a tool that people can use to check if they have depression, postpartum depression. A tool they can pull up on their phone and just check, or you ask your doctor to check with you. But even if that doesn't happen, you can just take the results to your doctor so that you can start treatment. What are did anything come to mind you want to share? Let me start with Miss Faladay.
Oh, thank you. I want to celebrate Mrs. Oyediro. Thank you for what you're doing. I'm impressed. Thank you. I'm an advocate of alleviating women's suffering. And so when I heard that you're doing something for women, I'm glad. Now, this one I want to drop with everyone tonight. It's that little thing that you can do to help. Don't ignore it. And it could just be telling somebody that the person is important. A lot of people are passing through things that make them, tend towards depression. And a little encouragement from somebody somewhere could, stop the advancement towards depression.
Yes.
Maybe somebody in your office, unknowing to you, the person is at the verge of a mental health challenge. And because of your attitude to that person, the person can find positivity in life again. That's what I want to say to that.
What about, would you like to say something about taking medication? A lot of people are
Oh,
Now let's run with that.
yeah. Because from my experience, I suffered for it when I skipped my medication. I mean, I suffered. When I say I suffered, it was serious one. It was as bad as I'll take half of an apple for a meal after serious encouragement because I skipped my medication.
Wow.
So I want to encourage everyone that is on medication. Don't be the one to decide what to do about your medication for whatever reason. See that professional that is attending to you so that you can discuss and decide with that advice. You will do the best for you.
So,
Please don't avoid help. Don't avoid help.
yeah. So with medication, thank you for saying that. As somebody who has used medication yourself, it worked for you. What happens?
Sorry, let me say it again. That even now, I still use sodium valproate.
Okay.
Yeah.
Okay.
And I don't joke with it.
Yeah.
But that was not the only medication I started with. So that's to tell you that you can get better by the day. When I started, at least I was taking about 3 medications. I remember I was taking sertraline. I was taking one other injection, so I can't remember the name. No, I'm not a professional. So I was taking that one monthly. The injection was monthly. Then I was also taking for that loss of sleep. I was taking what's the name again? I'm sorry. It's all this your I was taking something for sleep
Okay.
that maybe I will still remember before you close.
It's okay. So I will talk more about treatment next week. We'll mention some medication, but even from the medications you're mentioning, there might be some other things going on. Your doctor has your own diagnosis, but I want you to know it's very important to keep taking your medication. And like I say, if you want to stop, it is okay. What typically happens is when people start taking their medication and they start feeling okay, they think that they're okay enough and they can stop it. A lot of times, the mistake they make is that they stop it abruptly. Well, what we want is that we want you to take it for a length of time, which is usually 6 months to at least 1 year. We're looking for complete remission, which is when you've gone back to how you used to be before you started taking medication. After you've achieved that, we want you to take the medication for a little bit longer. And then we start gradually decreasing the medication. Like you started with 3, you are on 1. So based on what is going on and the symptoms, they can start taking what gradually decreasing the maybe the dosage, the frequency, then they start monitoring you and you are able to get off gradually then with therapy like you're doing in health. For some people, what now happens to you is that they stop abruptly. When you stop abruptly, it takes you a longer time to get back to your remission phase when you are restarting it again. And that's why a lot of times after stopping on and off, some people have to be on it for a lifetime. And there are people who do have to be on it for a lifetime. And this is when I say the instance of those who have to use insulin for diabetes type 2 sometimes. Some people will need it just because of how their own body organs are functioning. And some people might just use it for a while, start eating right, and then they're able to transition to just nutrition, just using their diet, exercise, and lifestyle changes to maintain it. But some people actually need to be on insulin like all the time. So it's the same for our psychiatric medication. So please don't stop taking your medication without telling your doctor. And there are times I've seen patients before who they just want to stop, maybe based on for religious factors or anything. When they stop, at least I know, and it's been documented, when they have a relapse or something happens, I'm quickly able to intervene. So that way, even if they go to the emergency room or they go anywhere, their spouse, their partner, or themselves, I'll tell them, always have your medication list with you. When something happens, give it to the provider. Let them know you stopped it, because I can't force them. Let them know you stopped it at this time, or if I want to start again, they can be able to know what dose to start with you again. That is the importance of telling your provider whatever change you are making to your treatment. And that's why your psychotherapist said, go back to your psychiatrist, let them know you stopped, and then you started working it back up again. And some people don't need medication, like in Miss Bola Zion's case. She didn't even know. She suffered through that for 2 years. And she started putting effort into that. Now, you are at a risk, there's so many risk factors, like I said when I came on your show. Difficult pregnancy, history of depression before pregnancy. We have what, we just call it perinatal depression, which can happen throughout the period. When it can start during your pregnancy period or after you've had your baby, whichever one it is. Some people, it is so severe that they need intervention. People have baby blues, which is just lack of interest when they have their baby, depressed mood, fatigue, they're just tired. But usually baby blues will last for between 5 days to 10 days. It can start like maybe within 48 to 72 hours after having your child. And a lot of people go through that and they overcome it. But postpartum depression is a more severe form of depression. It interferes with your personal care. It interferes with your bonding with your child. You start having severe depressed mode. It affects your appetite, your sleep, your self-perception, loss of interest in things you used to do. And the most important part is that it impacts your bonding with your child. And it is very severe, not just baby blues. And like I said, if you're experiencing this for more than 2 weeks, there's a high probability of you having postpartum depression. Now, talk therapy might work, and there's an antidepressant that is now FDA approved, at least in the United States, specifically for postpartum depression, especially when we start having suicidal thoughts. You start having suicidal thoughts, you start having negative, severe negative thoughts, rumination, everything negative, like say, calling baby monkey, not feeling good about yourself, feeling ugly, your sexual drive was gone, all those things. When it's severe, they use that medication. But if it's not that severe, they can use the other antidepressants here, and there are ones that are appropriate, even when you are breastfeeding. And your doctor can work with you, and it will not harm the baby. And there are some people that you can just help with, helping, we call it family psychotherapy. They tell your family what you need to do, they support you, they know, and they help you through it. So getting to know what's wrong, intervening can really make a difference. And why is it important to treat this thing? Because when you're not bonding with your baby, it can have its own effect on the baby itself. You don't have the normal bonding between child and mom. The child will not have the regular, will not grow up with the normal bonding. They can start having what's it called, like behavioral issues themselves, that lack of attachment that they weren't able to do. So it does not only impact the mom if you don't address it, it can also affect the child when the child grows up, their temperament and all other things like that that was supposed to have been taken care of with motherly bonding. So there's this thing we call Edinburgh postnatal depression scale. This scale, if any woman is having it, or a woman that just had a baby, we can give it to them. Tell your doctor, they will give you this depression scale. You can look through it and answer the question. But even if you don't want to, even if you're not showing your baby that, even if you don't see your doctor, pull this up on the internet. I'm sharing my screen now. Can you see it?
Yeah.
Okay. This Edinburgh postpartum depression scale can be used. You use this, answer the questions, and you will get your score. You can, there are ones that it's like this, that is going to show you how to even score it. So when you can fill this out, you'll see the score there. You take the result to your provider. So you can do it at home. If you start feeling, are you able to laugh or see the funny side of things? You'll be able to say, not much, not really. You answer this honestly, or you do it like in this one, once you click, whatever applies to you, is going to give you the result and even the interpretation of the result. So this is a tool we can use when we have people around for ourselves. Then you take the results to your provider. So that's something we can use, and we have the one for general depression too. So I really thank you, great women, again for sharing your stories with us. And anybody that wants to reach out to them, they're in the group, please reach out to them. They will be willing to help you. I'm here to help. The organization Help for the Depressed is, they just had something on Sunday, awareness. Reach out to these women. We're here for ourselves. And next week, I will talk more about treatment. You want to say something?
Yeah, I was just going to say, I don't know where the noise is coming from. I was just going to say something quickly. One of the major events that kind of lead to depression and maybe then turn to postpartum depression can be financial difficulty for women. Now, I'm a money coach, and this is one of the things I do to help people to sort out their finances. At the moment, Wonderful Woman Ministries, we've partnered with a Christian charity called CAP, Christians Against Poverty, and we deliver this money training for 3 weeks, once a week. Normally, we use Saturdays. It's free. Although we use the system within the United Kingdom. So if you're in the UK, reach out to Guy, you're going to reach out to me. And when we have classes, it will be a pleasure to take you on that journey. If you're in Nigeria or so, we can always find a way to adopt it to the ways things work in your country. But I would love women to stop being worried about money. Money is not everything.
Don't say women all the time. I want you to say men encourage your spouses, because
men encourage your spouse. Yes, encourage your spouse. Encourage them. To encourage them to seek help. Really, we need that support. Encourage your spouse, but don't suffer in silence.
Okay.
Reach out, but there's so many help out there for women. And as a woman, I used to feel guilty that I missed 2 years of my daughter's life. Don't feel guilty. In fact, be so proud of yourself that you've come to that awareness and you're bold enough to face your problems. Right. So if you can face it, you can conquer it. So that's the most important. So celebrate your awareness rather than feeling guilty. You are the best mom your child will ever seek for. That's the way I see myself. No matter how that is to our children, my daughter will never look out over me. That's just it.
I know.
So think that way. Right.
Okay, all right. So, Miss Temidaya, say bye to us in your own grand way, and then I'll wrap it up, and let's just thank everyone.
Esho.
That means thank you.
Omiekamo. That's the Jaw language from Nigeria.
Okay. This has
So,
been so
yes,
much fun. Thank you. Go
I'm
ahead.
so delighted that we had it. Despite the challenges I have there, I have issues with lights in here. So,
Thank you, beautiful woman. Please, you can, go ahead and share the link to your platforms here in the comment, and so people can easily reach out to you. And please make more comments, share more light, share more information in the group to help people in whatever way you can. We really appreciate you. To all our viewers, everybody that's taking time to watch this, we admire you. We thank you for taking the time to do this. We know, a lot of people feel like they don't they don't need this thing, or it's not their business, but you are aware enough to know that knowledge is power. Thank you for joining us. Thank you for inviting people. And next week, I will talk more about depression, the treatment of depression, and then we'll move to other topics. If you haven't invited anyone to this group before, please do so. And you are just helping someone in your own little way, whether they tell you or not. So thank you, everyone. Thank you, Ms. Bola Oyedinro, Mrs. Bola Oyedinro, for joining us, for sharing your story. I thank you also so much, Mrs. Temida Falade, for sharing your story. You have helped so many people, and God bless you. Till next week, everyone, keep helping everyone. Remember, your mental health matters. My mental health matters too. Okay? All right. Thank you. Bye now. Bye.